السلام عليكم everybody. معكم سعيد مبارك إن شاء الله. Today is a continuation of our lectures about drug treatment of pain. In today's presentation, inshallah, we are going to talk about the role of inflammatory mediators in the generation of pain and the site of action of anti-inflammatory drugs. So to help you to understand what we are going to speak about, I have made a road map. In the last lecture, we dealt with the pain pathways and the different types of pain and how they are treated with different analgesics. In today, inshallah, a lecture, we will start talking about non-steroidal anti-inflammatory drugs, or what are known as non-narcotic analgesics. In this topic, I have divided into 3 different lectures to make it easy to understand and to grasp. The first lecture, which is today, inshallah, will talk about the mechanisms of inflammation and the site of action of anti-inflammatory drugs with specific analgesic activity. In the next lecture, inshallah, we'll talk about the therapeutic uses and the mechanisms of action of the non-steroidal anti-inflammatory drugs, the aspirin-like drugs. This will be followed by the side effects and the contraindication of the non-steroidal anti-inflammatory drugs. These 3 lectures will be about the aspirin-like drugs or non-steroidal anti-inflammatory drugs. Then we'll have a lecture about paracetamol, which is different from the non-steroidal anti-inflammatory drugs, that it has only analgesic and antibiotic effect. This will be followed by the other group of analgesics, which are the narcotic analgesics, which are known as morphine-like drugs. And lastly, we'll talk about a group of drugs which are known as non-classical analgesics, i.e. they are not belonging or they are not classified as non-steroidal or narcotic analgesics. Okay? So this is generally the roadmap what we are going to talk about. So a revision of what we have covered last lecture, we talked about the pain pathway. We said that pain will pass through 4 different phases. The first starts at the level of the periphery, usually in a process known as transduction. In the transduction, we have said that sensory nerve endings, they are stimulated by certain inflammatory mediators. These will generate sensation or action potential or sensory input. This sensory input through the dorsal horn of the spinal cord up to the thalamus in the brain. And this process, we called it transmission. Once the impulse or sensory impulse reaches the thalamus will spread this impulse into 3 different sites or regions in the brain. That's why we call the thalamus as relay station. And mahatta. So what will happen? The thalamus will spread the sensory input into the limbic system for the emotional response to pain, as we have said, either crying or jumping or whatever. Okay? Also, the thalamus will relay this sensation to the sensory cortex. And we have said that the sensation takes place in the sensory cortex. So the level of stimulation, the place of the stimulation or of the pain, and the strength of the pain will take place in the sensory area. We call that perception. We call that perception. So this is the third process of pain sensation: transduction, transmission, and perception. Okay? Then part of this pain signal will go down again through the descending inhibitory pathway, in the fourth process, which we call modulation. Within modulation, we said that through the descending pathway, the incoming signal will become weaker. Why? Because inhibition will take place at the dorsal horn of the spinal cord, and we have said that this inhibition involves many neurotransmitters, including noradrenaline, 5-hydroxytryptamine, and GABA. Okay? So this is what we have covered last lecture, and we have said that analgesics, they act at different sites. Either they act at the level of the transduction, or at the level of transmission, or they act at the level of the central level. Okay? We know that pain is generated by different factors. The most common is multifactorial. Pain is multifactorial. The most common, which we all know, is a direct tissue injury. Like what happens after a cut or burning sensation or whatever. Okay? But this is one. The second factor which can cause pain is the immune-driven inflammation, the autoimmune disease. In the body, we'll consider certain tissue as a foreign protein, and it will generate antibody to it, and this will activate the immune system and results in damage of that tissue, as it happens in rheumatoid arthritis, for example. The fourth factor which can cause pain is the nerve dysfunction. Yasal dysfunction in the nerve, sensory nerve itself, which carries the impulses towards the central nervous system, as it happens in cases of fibromyalgia, or neuropathic pain. Okay? The fourth factor might be an altered brain processing. The processing of pain in the brain is altered due to central defect. The thing that joins all these multifactorial causes of pain is inflammation. They found that general feature usually is inflammatory. General feature is inflammation. In the different causes of pain, the general feature is inflammation. So they have said that if we treat the inflammation, then we can treat the source of pain. Okay? So this is the goal. This is the main goal of this lecture, is to know what are the different types of inflammatory mediators. So we are going to understand what are the different types of inflammatory mediators and where do the anti-inflammatory drugs act. Okay? Yeah, but this is the main goal of this presentation, is the mechanisms of inflammation and site of action of anti-inflammatory drugs. But just if we imagine a tissue is exposed to injury or infection, bacterial or viral. In this case, in this tissue, phospholipase A2 will be released. Phospholipase A2 will be released. The phospholipase A2 is a membrane enzyme. The phospholipase A2 will free phospholipid known as arachidonic acid. You have the arachidonic acid, usually it is bonded with the plasma membrane. In this case, phospholipase A2 will free arachidonic acid. Arachidonic acid will become free. It will be converted into different inflammatory mediators by two different enzymes. The first enzyme is known as cyclooxygenase. Cyclooxygenase. Cyclooxygenase or COX, as we will see inshallah next lecture, there are different types of COX. Cyclooxygenase will convert the arachidonic acid to what are known as prostaglandins. And of course thromboxane and prostacyclin. We'll talk about that in details inshallah in our next lecture. These prostaglandins are inflammatory mediators. What does it mean? They cause stimulation of the sensory nerve ending, causing pain. If the prostaglandins or BG, prostaglandins will stimulate the sensory nerve ending, causing pain sensation. Also, they can relax smooth muscles of blood vessels, causing vasodilatation. That's why we have the redness and erythema at the site of inflammation. Also, prostaglandins, when they are sensitized in the hypothalamus, they increase the threshold of the hypothalamus, and this will result in fever. Yeah, the prostaglandins are the first inflammatory mediators. What they do? They produce pain, produce vasodilatation, and they produce fever. Among other actions that we will discuss in detail inshallah next lecture, okay? The other pathway, arachidonic acid, once it becomes free due to tissue injury or infection, it will be acted upon by leukotrienes. Is another leukotrienes enzyme. Leukotrienes will lead to the formation of another inflammatory mediators known as leukotrienes. If the leukotrienes, there are different leukotrienes. Leukotriene B4, leukotriene C4, leukotriene D4, and leukotriene E4. Leukotriene B4 is very powerful chemotactic. Leukotriene B4 is very powerful chemotactic. What does it mean chemotactic? It causes attraction of immune cell to the site of inflammation. Okay? If the leukotriene B4 will attack other immune cell to the site of inflammation, we'll talk about it in few minutes. Okay? The other leukotrienes, they are very powerful bronchoconstriction. They cause bronchoconstriction. Okay? If the leukotrienes are inflammatory mediators, what they do? They do two different functions. The first is attracting the immune cells to the site of inflammation, and the second, they cause contraction of the smooth muscles of the bronchioles, causing bronchoconstriction. Okay, but these are two inflammatory mediators which are the product of arachidonic acid. Okay, now when tissue is exposed to injury, it will lead to the attraction of immune cells. Immune cells, as you know, there are different types of immune cells, including neutrophils, macrophages, T cells, and dendritic cells. They are immune cells. They are attracted to the site of inflammation when the tissue is exposed to injury or viral or bacterial assault. Okay? So what they do, these immune cells, they release another inflammatory mediator known as cytokines. We have two different types of cytokines, subhanallah. One type of cytokines, they are pro-inflammatory. Meaning they cause inflammation. The other type, they are anti-inflammatory, opposite. Cytokines, they are anti-inflammatory. Yani a new cell, they act in two directions. One is to increase inflammation, and the other is to prevent or decrease the inflammation. Pro-inflammatory cytokines, like tissue necrotic factor alpha. Tissue necrotic factor alpha and interleukin 1 and interleukin 6. These are pro-inflammatory. What does it mean, pro-inflammatory? Because inflammation and pain at the site of inflammation, this is the pro-inflammatory cytokines. After that, after the finishing of the process of inflammation, inflammation is protective. And it protects the tissue against the damage which takes place during an attack or physical insult or viral infection or bacterial infection. The second step is the anti-inflammatory cytokines. Anti-inflammatory cytokines. Anti-inflammatory, not pro-inflammatory. The anti-inflammatory cytokines, they increase immunity and they involved in the healing process. They are involved in the healing process, like interleukin 10, interleukin 11, interleukin 13. Okay? Yet the cytokines, there are two. Pro-inflammatory, which cause inflammation, interleukin like tissue necrotic factor like interleukin 1 and interleukin 6, which cause pro-inflammation, increase in inflammation. And the opposite, there are anti-inflammatory cytokines, the interleukin 10, interleukin 11, which have a healing effect. Okay? So these are the inflammatory mediators. Part of them, they are driven from the arachidonic acid, okay, through the release of phospholipase A2, and some of them, they are produced by certain immune cells. Okay? Now, this is the inflammation. Of course, this inflammation will cause pain, will cause swelling, will cause vasodilation, will cause of inflammation, and so on. So, how we can treat inflammation? How we can treat inflammation at different steps. We can treat inflammation by inhibiting the cyclooxygenase. By inhibiting cyclooxygenase 1. If we inhibit the cyclooxygenase enzyme, like aspirin does, aspirin-like drugs, like ibuprofen, like cyclooxygenase, etc., they inhibit cyclooxygenase, and they prevent production of prostaglandin. Once they prevent the production of prostaglandin, of course, there will be no pain and there is no vasodilation. So they have analgesic, antipyretic, and anti-inflammatory effect. This is one. The second, by inhibiting the phospholipase A2. By inhibiting the phospholipase A2. When inhibiting the phospholipase A2 means that we inhibit the production of prostaglandin and leukotrienes. Production of prostaglandin and leukotrienes. And in this case, we are blocking the production of two inflammatory mediators. And an anti-inflammatory effect will be very strong. This is done by corticosteroids. The corticosteroids. A third, by inhibiting leukotrienes, drugs which will inhibit leukotrienes, or drugs which will inhibit the production and action of cytokines. Okay? This is the third group. This third group, they are anti-inflammatory. They are not used as analgesic. Like they are used in other types of inflammation, like rheumatoid arthritis, etc. Okay? But these are very strong anti-inflammatory, as we will mention in a few minutes. Okay? So these are the three steps where we can inhibit inflammation. Okay? So the first group, as we have said, it will act on the cyclooxygenase. It will act on the cyclooxygenase. It inhibits cyclooxygenase and therefore inhibits the production of prostaglandin. These are known as non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. And aspirin-like drugs, like aspirin, like ibuprofen, like cyclooxygenase, etc. Okay, this is the first group. The second group, they act, second group they act at the level of phospholipase A2. They act at the level of phospholipase A2. They inhibit the phospholipase. This will inhibit the synthesis of the two inflammatory mediators, both prostaglandins and leukotrienes, and they are very potent anti-inflammatory. They are not used as analgesics. They are used only as anti-inflammatory. This includes the corticosteroids in general, like prednisone, like prednisolone, like dexamethasone, etc. Okay, yeah, this is one. The third, they are known as non-classical or targeted anti-inflammatory. Non-classical معناها they are not like aspirin-like drugs. These are the drugs which inhibit leukotriene action and receptors like montelukast and zilotone. The other which inhibit cytokines, the pro-inflammatory cytokines. This includes very famous examples, infliximab and tocilizumab. Okay? Yeah, but these are usually, they are not normal analgesics. They are used for specific types of inflammatory reactions. Yeah, but these are the three classes of anti-inflammatory drugs. These are the three classes of anti-inflammatory drugs. The first, they are the non-steroidal anti-inflammatory, which acts by inhibiting cyclooxygenase. The second, they act through inhibition of phospholipase A2. And the third, they are the non-classical, which act either on the leukotrienes or the cytokines system. So this is very shortly the inflammatory process and the role of inflammatory mediators in the action of non-steroidal anti-inflammatory drugs. Inshallah, in next lecture, we'll start talking about the pharmacology of non-steroidal anti-inflammatory drugs, including kinetics and therapeutic application and their mechanism of action. Okay? Thank you for your attention and see you again in my next presentation. Assalamu alaikum wa rahmatullahi wa barakatuh.
شكرا لكم على حسن الاستماع. الرجاء لا تنسوا الاشتراك في القناة، الإعجاب، التعليق والمشاركة مع الزملاء. دمتم بخير وعافية، والسلام عليكم ورحمة الله.